The number of COVID-19 infections in the United States has exceeded 1 million. That's almost 1/3 of the world's total cases. Despite this, dozens of states have begun easing restrictions to try to restart a failing economy.
A ceremonial flyover of New York as U.S. military flight squadrons paid tribute to coronavirus healthcare workers and first responders. They are battling the worst COVID-19 outbreak in the world, with cases in the U.S. doubling in just 18 days, past the 1 million mark. But the U.S. president says the country only reached this grim milestone because it's testing more than others.
We are way ahead on testing. We are the best in the world on testing. We've tested much more than anybody else, times two. Or every country combined. We've tested more than every country combined.
Most health experts contradict that view. They say the number of people sick with COVID-19 in the U.S. is higher than the reported number of cases because of a shortage of trained workers and limited testing capacity. And many Americans who need the test the most are simply not getting access to them. Despite the warnings, more states are easing social distancing restrictions to get the economy back on track. Georgia has begun allowing people to dine inside restaurants for the first time in a month. Several other states are also reopening businesses in phases. But the epicenter of the crisis, New York, has ruled out resuming normal life over concerns about a second wave of infections.
We want to reopen, but we want to do it without infecting more people or overwhelming the hospital system.
Lawmakers have abandoned plans to return to Washington next week because of the coronavirus. Democratic leaders have extended their recess after seeking advice from an official physician. The Republican-run Senate, however, will resume next week. Adding to the political controversy in Washington, Vice President Mike Pence has come under fire for not wearing a face mask when meeting with medical staff and researchers during a visit to a medical clinic. Mr. Pence said he didn't need one because he's frequently tested for COVID-19.
People that may have the coronavirus could prevent the possibility of conveying the virus to someone else by wearing a mask. And since I don't have the coronavirus, I thought it'd be a good opportunity for me to be here, to be able to speak to these researchers, these incredible healthcare personnel, and look them in the eye and say thank you.
The Mayo Clinic tweeted that it had informed the vice president of its mask policy prior to his arrival. The tweet was later removed.